Good afternoon, everybody, and welcome to the Hounslow Health and Wellbeing Board. I'm Councillor Lily Bath, and I welcome you all here today. And I also welcome those that might be joining online. We also have somebody in the audience today in public here. And so welcome. I hope you enjoyed the meeting. Just to let you know that there's no sort of participation from members of the public, so just that, so that you are aware. But okay, thank you. I think probably it might be nice if we did a round of introductions, if that's okay. I think this is our first meeting in the new administration. I think the last one was in January sometime. And I'm chairing the meeting. Unfortunately, you've got me again. I'm chairing the meeting because of my portfolio responsibility, which is adult social care, health and wellbeing, which makes me which gives me the honour of being able to chair this board. So that's myself, Councillor Lily Bath. I also represent the Heston West ward. So I'll go on my left. That's okay.
Good afternoon, everybody. I'm Martin Waddington, the Director of Health and Care Integration for Hounslow.
Hi, everybody. My name is Katie Coleman. I'm a GP by profession, and I'm the new Deputy Chief Medical Officer of Western North London ICB.
Peter Goulding, Chair of Healthwatch Hounslow. Very good afternoon.
Ajit Bansal, Head of Climate Emergency, Hounslow Council.
Kasturi Ravindran, Insight Lead in the Policy and Insight team.
Sterling Rippey, Principal Public Health Strategist in the Council.
Claire Gom, also Principal Public Health Strategist in the Council.
Afternoon, I'm Stephen Forbes. I'm the Executive Director for Children's and Adult Services here at the Council, and I do apologise, Chair, I may actually have to just nip out this meeting and return at a later date.
Good afternoon, Anna Hesed, Head of Finance supporting children and adults at the Council, as well as Public Health and Commissioning.
And Chaspal Sandhu, I'm from Democratic Services.
Thank you very much. And before I go on to apologies, I need to check if there are any declarations of interest. I think that only applies to members, doesn't it? And I'm the only one here. So none from me. So yeah, thank you. All right. And apologies. I've received apologies from Liz Brutus, who's our new Director of Public Health, Sheena Basniaki and Sanjay from Chelsea and Westminster NHS Foundation Trust, and also Chris Hilton as well. Any other apologies? No? Okie dokie. In that case, let's move on to agenda item 2, which is the minutes that were held 13th of January. Gosh, that seems like such a long time ago. I'm not going to go through all of the minutes, but if you could... If you can look through them and let me know if you think they're a correct record of the last meeting. Yep. Okay, perfect. Thank you. Are there any other matters arising from the minutes that are not sort of on the agenda or can be dealt with? No? I couldn't see any when I looked through it, but I don't... No? Okay. Perfect. Brilliant. In that case, what we are going to do next is actually do not the last agenda. We're going to do agenda item 8 because we have Katie Coleman here, and she's from the North West London ICB. And she was going to give us a verbal update under agenda item 8, but we thought we would have a proper update. And we've deferred this item to the next meeting. So, but it would be great if you could introduce yourself now and just tell us just briefly, what your role is and your sort of, your contributions to the committee here.
Absolutely. And I think it's probably a really wise thing to have sort of deferred the update on the ICB till sort of the next meeting, because the ICB is still in a significant sort of change programme, and it's going to take us a little while to sort of bed in and sort of work out what everyone's doing and you know, what our strategy is and where our vision is, etc. So I'm grateful for the decision to defer. I think that was really that's very helpful. As mentioned, I'm a GP by background. I work in a practice in Islington. I've worked in North Central London for many years. I've worked in the commissioning space for a good 20 years, and I've worked across pretty much every single part of the commissioning of landscape. So from maternity to children to integrated care, primary care, elderly people, long-term conditions. In fact, the only area that I probably haven't worked in is mental health. So that would probably be my sort of weaker area. But I'm now currently working as a Deputy Chief Medical Officer to Dr. Joe Savage. I took up that role at the beginning of May. So this is kind of my third month in my new post. And actually, I came to Hounslow about sort of 2 months ago to sort of hear a little bit about your sort of new integrated neighbourhood team sort of working, and sort of met sort of colleagues sort of who had just sort of initiated that sort of programme of work, and it was very inspiring to sort of see the work in train. So I'm really grateful to have the opportunity to be with you all today and to be part of Hounslow and the Health and Wellbeing Board, and to bring the sort of the ICB sort of views into this sort of discussion.
Lovely. Thank you very much. Thank you for sharing that with us, and we welcome, you know, all your experience to the board. So, and we look forward to the update in the next meeting. Thank you. Okay, so what we'll do is we'll move on to the agenda item, which was agenda item 3, Health and Wellbeing Quarterly 4 Progress Report. And I am going to... I've just had a blank moment. Then I'm going to Claire to present some of the updates, and then we can, once you've done that, we're happy to take questions. Thank you, Claire.
Thank you, Chair. As usual, we are bringing a select few of the highlights. We have a full progress report, so it's too extensive to go through individually. Fortunately, this quarter, we didn't have any that had been RAG rated as red in terms of progress. So just going to take a couple that have been highlighted as green and making good progress. The first one is in the children and young people's section, and that's around the creation of a new mental health and wellbeing hub that will be starting soon for young people in Hounslow. The hub has been entirely co-designed with young people in the borough. So they have chosen the name, which has been labelled Think Well, and they've created a logo as well, which I don't have to share, but all of the activities and the way that this will be run has been co-designed with secondary school children. So at the moment, the hub is due to start in August. Initially in the pilot phase, it will be 3 days a week, suitable hours, so not early in the morning, with kind of after school into the evening. And I think the idea is clearly to not replicate clinical services. This isn't a clinical service. This is around keeping people well. They will be able to go in and out free flowing. The people who are leading on this project are within Martin's team. They've made it very clear that there will be strong clinical pathways for those who they may identify need other support. There'll also be an emphasis on bringing partners in. So, for example, in our area, HYPE, the Young People's Drug and Alcohol Service, will be going in certain days a week, depending on need. And they're in the process of still putting in a full timetable of positive activities, group work that may cross with those other services as well that young people have identified as helpful. But I think the emphasis is really on a safe space for young people to be. As I say, it doesn't need to be that they're going there for one specific intervention, but it's somewhere that they can feel that they're well and looked after. So, as I say, this is at the Beavers Children's Centre and will be a pilot beginning in August. So that's a really good news story. Any questions, or go on to the next one?
So I think it's an excellent project, excellent news, really good for young people, really well co-produced. Katie, just bringing to you straight away, you know, what Hounslow is really keen on is how we improve prevention, community, neighbourhoods, all of the language that we're now being used, but very keen to understand going forward how, so for your next meeting, but very much how the left shift money that we've heard about for so long, how is that going to start coming to Hounslow? How will you share it with the Health and Wellbeing Board? And very much, how do we develop more of these community projects, especially for young people with mental health issues? So not a question for today, but a question for next time.
Yeah, no, I was just going to say I was very excited about this particular project, and I'm really keen to hear how it's received and how it goes down well with young people. And it's a great location as well, isn't it? It's really in the heart of where the need is. So really pleased. Sorry, did you want to say something?
My question, where was it located? I think I missed that.
The Beavers Children's Centre. Okay. The second item that we were going to mention was around health checks. So I think most people are aware that we have two different kind of health checks that are on offer in the borough. We have the GP universal health checks, but also we put a lot more emphasis on targeted health checks in the community, particularly in areas of core 20 residents. And so it's just the good news that by the end of the year, in terms of the number of health checks done that were targeted, we had a target of 7% in core 20 areas and we reached 7.4%. Also, we do some workplace health work, and that includes health checks. And 8% of those who received health checks in the workplace were from our core 20 resident cohort. So that's really good news. And I think just to add to that, although that's the full health check, there was another 15,000, well, not 15,000, I'm sorry, I've done this with my numbers twice today, 1,500 blood pressure readings taken in the community in those outreach spaces that led to more support of one form or another. That did not complete a full health check, but in terms of that preventative model, still incredibly important. And the context also in terms of those NHS GP health checks, we had a target for Hounslow last year of 8,000, and actually the final figure was 14,229. So we surpassed in both areas, so the universal and the targeted checks. So that was just a good news story.
Thank you. That's really good. So we basically exceeded our targets, haven't we?
In both.
So
yeah.
We're getting, obviously, the message is getting out, isn't it, to the community in terms of getting getting them to come forward for our health checks.
Yes,
that's really positive.
Yes, I think so. Although our model's adapted as well, as we say, to make sure that we're going out to people in those areas where they weren't coming. So yes, in terms of that,
but you're quite visible and people are coming to you, which is really good.
Yeah.
Oh, excellent. I'm really pleased to hear that. Thank you, Peter.
This is not a specific Healthwatch. I am a community partner in Imperial. Imperial Public Health have been doing a study on behalf of the Cabinet Office on GP health checks across the whole of North West London. I can't go into the details because it's not been published yet. That detail is going into the Cabinet Office, but it will be published. I think that would be very interesting for you to look at. Hounslow is, in my view, is slightly better than some of the other boroughs around North West London, but we still have a substantial problem if we look at the number of people who should be receiving a GP health check and the percentage that do not go for a health check. That study would be very interesting for you to look at when it's published, because they have surveyed people who have not taken up a health check after being contacted by their GP. And there are some substantial issues and barriers, etc., that have been highlighted, some of which, if we go down into the details, we would expect to see. But the challenge is how do we get over that? For example, I'm on a 0 hours contract. How can I take time off to go to a GP? I have no childcare. I don't have the transport or the money to be able to transport, etc. So childcare is a big, big barrier. And this report, when it finally gets published, I think will give you some granular detail, which will help the borough, but help others in North West London to actually focus on where are we doing it quite well, but more importantly, why is it people are invited, but they're still not taking up the health checks. It also has been looking at some of the analysis that says, you talk about the blood pressure, it looks at the analysis to say, what have we actually found in terms of the health checks and what prevention have we been able to give, how many people with diabetes, health conditions, heart conditions, etc. So that data would be very useful when it becomes validated and published. I haven't got the date when that will be.
Thank you. Yeah, that will be helpful. We're in a continuous improvement cycle, and we're looking at the quality of health checks, particularly this year, so that to make sure that actually the completion is accurate and that those onward referrals are made, but also continuously getting feedback through our health outreach team, particularly around reasons why people might not take things up. So that will add to our picture. So that's very helpful.
And I think it's very useful that a lot of the people who are not doing health checks are not just sitting in that core 20 sort of group.
Yeah,
it goes right across the board. So something that we would probably need to focus on going forward.
Thank you. And the final update is a brief one on the progress report. This is actually amber because this was Q4, but we have moved this forward and this would be a green, and that's in terms of our falls work. So we are no longer number 1 in London in terms of our falls rates, and we've had a 2-year decline, so that's a very positive thing. But also just the really fantastic news that all the work on that pilot around the clinical falls service has resulted in the falls service now continuing with mainstream funding. So that's a really, really good piece of news that we now have that permanency in terms of the clinical offer, which means that our focus in the public health team is moving back to looking more around that prevention offer, which we've carried out various piloted work around things like strength and balance classes, Otago, etc. And we're now looking to make sure that we have a cohesive, clear offer across the borough for that prevention piece, as well as the mainstream clinical full service. So definitely agreeing now.
Thank you, Claire. That's amazing news. I think I've been a council for quite a while now, and we've often heard that Hounslow has the highest falls. And I'm really pleased that the work that has been put in means that we're not the number 1 sort of culprit now. So that's really good. I actually also wanted to share that I have actually referred some residents to the full service, and it's been very well received, and provided some really good outcomes. So some really good work going on. Really, really pleased. Yeah, on that. Thank you very much. Is that any other good news? That's plenty. That's for the moment. Yeah, no, that's brilliant.
Today.
Yeah, thank you very much, Claire. Before we let Claire go, any other questions at all? No. Stephen.
So thank you, Chair. I think I'll continue probably some of the good news stuff because I think it's worth us extending that a little. So I think I'd make reference, because it is marked green within the update report in terms of start well roundabout readiness for school. I think we've done some exceptionally good work across public health in the early years service in terms of getting a bit more focus on that. Just to report that our Best Start Family Hubs plan, I never quite get that wording right, it'll take me another year to get it to trip off the tongue, was approved by Department for Education, which is a really good and positive thing. And without quoting the number, because I have had a look at provisional numbers for children achieving a good level of development, it would look like we've made a significant dent already within the target we have within the local government outcomes framework, which is linked to fairer funding programme, in terms of a 9% increase over 2 years. It looks like we've made a significant dent on the combined work we've done across early years in public health. So hopefully at the future meeting we'll be able to report that actually that number is now accredited and confirmed, but it looks like we've done some really good stuff there. I would also say under the Live Well bit, and Claire's probably been a bit reserved on this, about just to recognise the work we do in the drugs services, primarily because Claire majors on the drugs stuff. So as the chair of the local drugs board, I think we do exceptionally good stuff in terms of treatment through our service provider there. But also Claire and I have had some interaction with colleagues at Feltham, Feltham B side, not the children's prison side, but the adult side, in terms of exceptionally good work that's being done within Feltham as a prison in terms of supporting prisoners who want to live a drug-free lifestyle within the custodial setting. So whilst we're not responsible for those prisoners, I think it's always worth recognising the work that's actually done to enable people to come off drugs and prepare for when they return back to society. And I would probably, if we get some space further down the line, encourage maybe the Health and Wellbeing Board to hear from the team in Feltham, because I think it's some exceptionally good work that we could probably highlight to government is actually worth looking at, given that the Minister for Prisons is in himself well known for his view in terms of rehabilitation and giving people second chances. So maybe something that we'd want to look at in the future if we've got time on the agenda here.
Yeah, no, I think that's a really good idea. Would be happy to do that, hear from them. And again, some really good stuff going on there. Thank you very much. I just have a question, and it's regarding, it's page 23, and it's really around the whole issue around obesity amongst adults and where we are going with that. I know obviously it's a very, long-standing issue, and we've got lots of different interventions in place, but it was just whether if you feel we're going in the right direction. Is there any other stuff we need to be focusing on a little bit more? I don't know. You can share anything with us on that.
I think we might be taking this between us, Councillor Bath. I think at the moment there is a lot going on, as you say, but we are reviewing that offer, because it's obviously that combination of targeted support, the actual food environment. So we're looking at the food strategy, and also in terms of that physical activity offer. But I know that in terms of the direct support offer, we will be looking at that and how that will need to be transformed. Hopefully the work around the food strategy and the food environment is something that we can also prioritise and move forward this year, and that's something that we've committed to as a council. Was there anything to add, Sterling?
I was only going to add that we're taking kind of approach to look at more targeted engagement in our existing services. So looking at specific cohorts within that, obesity data, looking at maternity, looking at women, etc., trying to think what can we do rather than just a broad approach. Where can we kind of target that engagement with services directly, working with our primary care colleagues, working with the maternity clinic, etc., trying to engage with patients and residents when they're ready, and trying to target that intervention. So there's a lot of work in the public health team to look at the plan for this year, which will come out and probably form part of review of the health and wellbeing strategy and the new strategy to come.
Thank you for that. Stephen.
So again, I think me probably adding to the highlighting of good news. I think under the Age Well section, in terms of the objective to ensure that carers are recognised, supported and valued, I think we do need to recognise that, again, with the support of public health and adult social care and other colleagues, we've done, I think, quite a lot of good work in the last 12 to 18 months to really expand and solidify that offer. I think we would recognise we've probably still got a fair journey to go yet, but I think the feedback we get at the moment from those engaging in that enhanced carers offer is that it's really positive, particularly for people with dementia, and the number of dementia cafes now that we seem to have popping up all over the place across the borough. So I think good recognition there in terms of what we've achieved. Journey to go yet, but I think probably again something maybe later on in the year that we'd maybe want to have a look at. I know that our internal scrutiny committee are probably looking at support for family carers, but it may be something we want to say, is there more work we could do collectively across the system to enhance the support for family carers? So maybe something we want to look at in a future agenda.
Yeah, no, I mean, I echo what you've said. I mean, I attended one of the carers events, and a huge amount of work's gone on since we first took on the challenge of actually providing more services for carers. And it was busy, but if I get the regular sort of bulletins in terms of what's on a regular basis, and there's a huge amount of stuff on, which is really good. So really positive. But I also do take your point about family carers as well. I think that's an important one. So yeah, we need to sort of focus on that as well. Is that what you were referring? Yeah. Parent carers. Yeah, absolutely. Thank you. Sorry, I should put my mic on, shouldn't I, really, when I speak? Okay, thank you very much to Claire for that. And we now move on to agenda item 4, which is an update around the Heathrow expansion. And obviously we've heard from the government some time back about their proposals. So we as a Health and Wellbeing Board want to hear about what the timelines are, what the proposals are. And obviously because we live in the proximity of the airport, we know obviously there are benefits as well as impacts as well. So we thought we would bring this be a good time to bring this to the Health and Wellbeing Board. So Ajit, I think it's yourself and Sterling, you're going to do a sort of the presentation to us. And I think we'll let you do the presentation and then we'll take questions afterwards, if that's okay.
Thank you, Chair. So I'm going to give you just a brief update on what's been happening around Heathrow expansion. I'm going to start at the very beginning about what the Council's policy position is. So at present, the Council's position is that Heathrow should be better, not bigger. That's been our stance since 2006 when the aviation policy was adopted. What that essentially means is that the Council opposes Heathrow expansion, but at the same time, we do want Heathrow to be managed and run a lot more efficiently. That policy position is currently being reviewed and updated. In the Labour manifesto, it was clear that they wanted to see that Heathrow worked for Hounslow. So we want to ensure that any benefits that come from Heathrow Airport, they benefit our residents first and foremost. So in the future, I can bring an update on what that narrative looks like, because we are keen to ensure that, particularly from a growth perspective and the way it's now linked to health, that if the airport does expand, we do secure the jobs, we do secure the health benefits, we get proper environmental protection for our residents. I hope this doesn't get too technical, but Heathrow Airport is essentially a national significant infrastructure project, an NSIP, particularly from a planning perspective. With that in mind, it's very different to your typical average planning application. Heathrow has to develop a development consent order, which it's different to a planning application, but it's also very similar. So the decision is not made by the council. The airport is on our boundary. It's actually sits within Hillingdon, but we are one of the key consultees that the airport needs to engage with. So whilst we can influence the development proposal, we are not the decision maker. That sits with the Secretary of State and not with the local planning authority. The whole point of DCOs was so they were a lot more streamlined compared to what was HS2, which was a planning application that took well over 10 years to be approved and agreed. Government wants to speed up the process, so they have set out what we now call a DCO, Development Consent Order. Earlier this year, as I mentioned, the Chancellor, in 2025, the Chancellor agreed to look at Heathrow expansion, particularly from a growth perspective, and it also invited proposals from applicants that would like to see Heathrow developed. 7 proposals were put forward, and it was actually Heathrow Airport Limited's proposal on the Northwest Runway scheme that they endorsed and took forward. The whole point of that endorsement was to then set out the airport's national policy statement, which is essentially a policy framework that the Secretary of State will use to determine that planning application, the DCO. With regards to Heathrow expansion, HAL, one of the applicants, are proposing to build a 3rd runway, which is 3,500 metres in length. They're proposing a new terminal complex where, to the west of Terminal 5, and they look to modernise a lot of the buildings on site. This does have quite a few knock-on impacts, so they are looking to address some of the surface access issues. Just moving on, as part of their DCO proposals, HAL have not published any indicative noise maps. So, for example, at the moment, Heathrow have 480,000 air traffic movements a year. Under a third runway, they are looking to have just over 760,000 air traffic movements. In order for us to understand what that noise impact will be on our residents, we really need to have a good understanding of the noise contours and what insulation they could provide. To date, they have not provided any of that because they're still developing it. But we do know from previous DCO proposals, because this isn't a new concept. I think this is round 3 that I'm aware of. Heathrow are proposing runway alternation on all 3 runways. They are suggesting a ban on night flights and offering respite for residents. As always, the devil's in the detail. But what you can see on the screen at the moment is just a map of the way the flight movements happen at Heathrow at present. And that's just within 480,000 air traffic movements. So you can imagine if you add another additional third ATMs onto that, you would not be able to see the OS map underneath that image on the screen. In terms of the Heathrow expansion timetable, government are currently consulting on the ANPS, which is the Airport's National Policy Statement. This is now known as the Heathrow Expansion National Policy Statement, and they hope to conclude that consultation on the 1st of September. After that, Parliament will make a decision to ratify it by the end of the year. So you can see that the government is moving at a very fast pace to get a decision made. At the same time, Heathrow are developing their DCO application, and they hope to consult with communities this autumn. We have no information at the moment what that consultation will look like, but the council will be formally responding to that. Once that consultation's over, they aim to submit an application to the Secretary of State and the Planning Inspectorate by the end of 2027. So this is, whilst it's they're trying to speed up the process, we're on quite a bit of a journey with Heathrow. To complicate this, and this is a bit of an anomaly, typically within an NSIP application or project, you will only have 1 developer come forward. With Heathrow Expansion, you've got 2 developers now coming forward proposing development on site. The second developer is Heathrow West Limited. They manage all the Aurora Group hotels down the Bath Road. And similarly, they're proposing a new modernised terminal and a shorter runway, which I believe is 2,400 metres in length and won't have knock-on impact, say, on the realignment of the M25. So as a council, we are having to work with 2 developers for such a large, significant infrastructure project. These aren't the only developments happening at Heathrow. You've also got the Easterly Alternation Infrastructure Works. So as you can see from the screen, to the northwest, Heathrow hope to realign the taxiways so aircraft can fly over Cranford. For a long time, aircraft could not fly over Cranford due to the Cranford Agreement, which was an agreement not formally recognised, but like a gentleman's agreement between Heathrow and the government. In 2015, the Airports Commission said, we're going to scrap that agreement. Heathrow can depart from the northern runway over Cranford, which brings more noise impacts to our communities and schools in the area. That application was approved by Hillingdon Council earlier this year. We expect to secure mitigation for Hounslow residents. So up to 752 properties in Hounslow are eligible for £3,000, and a further 218 properties are eligible for £12,000 worth of mitigation. We have a number of schools in Hounslow, and there's approximately 2.5 million available to mitigate the impacts. Because the Easterly Alternation Planning application was determined by Hillingdon and not the Secretary of State, we are engaging with Hillingdon to secure this mitigation for our communities via a Section 106 agreement. So there's quite a lot of development already happening at the airport, but there's more coming as well through the expansion. I'm going to move on to around the governance and the stakeholder engagement that is currently taking place. We obviously, as council officers, engage with Heathrow Airport, whether that is through KISHA, which is the Council for Independent Scrutiny of Heathrow Airport. As part of the Civil Aviation Act, Heathrow have to have an independent body that oversees all development impacts at the airport. So we do regularly attend the KISHA meetings where we talk about the noise, the airspace, the air quality, the economic growth, and surface access issues. Alongside that, we also engage with the Heathrow Strategic Planning Group, which is a partnership of 9 local authorities that come together regularly to look at the spatial planning matters impacting the sub-regional area. That covers everything from transport, environment, airspace, public health, and economic development. Alongside that, to just complicate the governance, there are separate bilaterals that the leader of the council has directly with Heathrow, but we also have officer-led planning bilaterals, and those are specific to the expansion programme. And then we do regional engagement with the GLA and West London Alliance. All this work gets fed into an internal steering group that is chaired by Mandy Skinner, and then up to a corporate leadership team and then cabinet. Because there's different conversations around difficult or different technical topics happening all the time, we try to bring it all together and it's coordinated. And that's just the working groups that we engage with. Heathrow have their own working groups related to the DCO. So you can see the infographic on the screen. To help them develop their DCO application, they have set up approximately 12 to 15 different working groups on different thematic areas. And I'm going to bring in Sterling here to just highlight some of the public health ones.
Great, thanks, Sajid. So I wanted to bring the kind of context of the Health and Wellbeing Board and the members up to speed on where things are happening specifically in relevance to each organisation and where involvement over the next few years is key. So there's 4 what are called working groups highlighted here, which are specifically looking at expansion, which relate to health and the determinants of health, as well as public services themselves. So the first one on the left, whilst called Communities and Disasters, includes, sorry, it's actually the one on the right, the Community Subject Working Group. Forgive me, these meetings change about every week. Communities Subject Working Group looks at the impact on public services. So this is a working group which would be relevant to the NHS trusts in the organisation and the impact of the expansion on public services, including our NHS trusts and organisations. The Health Impact Assessment Steering Group has now initiated, and so since publishing this paper, we've had our first 2 meetings. This is a steering group which is chaired independently and meeting monthly, minus August, to look at the development of a health impact assessment. So the applicant is required to submit within their environmental impact assessment a chapter on the impact on human health. So this will look at the exposure to noise, air quality, movement of homes, a copious, about 30 indicators, so I probably shouldn't bore you with them, and the impact that has on health and well-being across the general population as well as vulnerable populations. The process for this has initiated, and the topics that will be discussed across each meeting has now been shared with us. There's probably meetings which are more relevant to some organizations. One meeting which we're expecting to happen in the future will look specifically at the impact on public health services. At that meeting currently, Hounslow's public health council is represented by the Director of Public Health. However, all NHS trusts and ICBs are invited, and there's no other Hounslow representation. So I just wanted to flag that to the board here, And we have flagged that to the chair to sort invitations out and make sure, but just ensuring that each member goes back to their organisation, decides who and may be relevant to attend that. We see representation across ICBs forming medical directors from the hospital and trust seem to be the kind of colleagues that are coming to the Health Impact Assessment Steering Group. So that's one I really just wanted to flag, which is initiated over the last month and will influence the health impact assessment that Heathrow Airport Limited will submit to the DCO process. In addition to that, these kind of two other meetings, one which has not yet started is a mental health subject interest group. So Hal has pointed out that the association and evidence around noise and its impact on mental health has been increased since the 2018 consultation. So there's more evidence around the impact of noise on mental health. And therefore, they wanted to set up a specific group focusing on the impact. But this is looking at not just the expansion, but the current impact of the airport as it is now, and the considerations of any mitigations plans. So that's not completely within this DCO application process, yet they will be talking about the expansion. So it's one particularly important to flag to our West London Trust colleagues about attendance. We will be sending council representation to all of these meetings. But these are the three meetings which I would highlight to board members to consider representation for going forward over the next few years. And if you'd like to get in touch with who the kind of administration between Ajit and I, if you contact us, we can help you do that. But this is all kind of fast moving, so we thought it was really important to bring in the first instance. There's other meetings around air quality, noise, etc., which will, that information at those meetings will be shared with these three working groups where relevant. And the internal steering group is really good at organizing that work. In the last month, as Ajit said, the Department of Transport published what is known as the Heathrow Expansion National Policy Statement. This is a policy framework against which any future application will be adjudged for. So it doesn't set out the consent itself, but it paves the way for what the government would expect an application to look like. This includes, the consultation was live as the 18th of June and will close on the 1st of September. So all organizations and public are able to comment and submit a consultation response. The government's really interested in 4 key tests. So the must-meet tests against climate change, noise, air quality, and economic growth. All 4 of these tests have an impact on health, both positive and negative. In addition to that, the Department for Transport published their own health impact assessment, equality impact assessment, which sets out their view of the impact of this decision on health and well-being at a high level, given they don't have the detail of each proposal at this stage. So that is currently out live and would receive a consultation up until the 1st of September. And that includes any mitigation, a framework for how mitigation should be identified and how community compensation should be funded and delivered. So this is really the policy framework setting out what the national government is expecting an applicant to submit. The health impact assessment itself, I won't spend much detail. These papers more from these slides here and more for information if you wanted to know what's currently in it. But really, we wanted to flag that this consultation is live and it closes at the 1st of September. So if board members across different organizations wish to respond, that opportunity is now live as of the 18th. And here is just an information on many of the chapters and topics which are discussed within this health impact assessment. In the directors of public health have been meeting to discuss what they would expect a good quality health impact assessment to understand the impact on population health across the region through the Heathrow strategic planning group, so many acronyms. So collectively, the directors of public health across the system have discussed around what is a good quality health impact assessment and how do we make sure that that is produced such that we can understand the impact and understand the appropriate mitigations to reduce any negative impact. So really the kind of ask to the Health and Wellbeing Board members is to acknowledge the kind of upcoming work across the meetings to identify what the relevant stakeholders who should attend these future meetings, particularly the Health Impact Assessment Steering Group, the Community Subject Working Group, and the Mental Health Subject Interest Group, but also recognise that that consultation on the policy framework is currently live and closes on the 1st of September. Have I missed anything? I'll leave it there.
Thank you. Thank you both, Sterling and Ajit. That was very comprehensive. A huge amount going on. I'm just trying to get my head around it. So there's a consultation till the 1st of September. And as a council, we'll be feeding into it. In terms of engagement around the health impact assessment, what do we as the board need, well, I'd quite like to open it up to discussion. What do we as the board need to be doing to sort of feed into that, really?
I think the first sorry. No. Yeah, okay. I think thank you, Chair. I think the first instance is to make sure we have representation on the steering group, and to make sure that which we do have with the Director of Public Health, but just recognising that there will be an impact on a need to understand any impact on public services across the NHS. I think at that stage, the consultation with that meeting will take place over many, many months for the next year, essentially, up until that submission. So the opportunity to engage and support the development of that health impact assessment is key, and making sure it's of good quality.
Thank you. Peter.
Chair, thank you. In answer to your question, I think one area, maybe for Katie and the ICB, is of course the acute providers. There's a section there around major incidents and disasters. Any incident that will happen at Heathrow, West Mid is a designated hospital, as well as Hillingdon, etc. And of course, there will be an expansion if you've got that many more flights. And we've now got flights taking off and landing on the same runway, which would be a difference potentially, therefore disasters, etc. So I think it would be useful the ICB and the acute providers are aware of the consultation, because they would want to make sure that they are on those groups to influence any expansion of resources that they may need to be able to respond to something like Heathrow. Because they've got a structure built now, procedures for the current level of activity, therefore, and of course this is expanding, so they would probably want to include on that. As a local resident, we've received sort of one publication from Heathrow West saying that we want to consult, which is pushing the idea of this short runway that won't go over the M25. Therefore, think of all the disruption we're not going to provide you, but we'll do that later. We've not heard anything from a secondary provider. And again, it's quite vague in terms of, oh, sign up to our newsletter and we'll consult you, but nothing about any form of consultation. So it's a very vague leaflet that's come through, and even their website is absolutely lacking any form of detail at all, or way which you can contact people. Unlike the previous process, that we had a very detailed consultation, very clear plans, and in those plans were substantial changes to the National Air Traffic Control System, which will allow dual use on a runway. Huge amount of work. That also included the routing, completely different from the slide you've done, but also quite a lot of work on noise. And of course, I don't know whether any of that is carrying over from the previous work a few years ago to the current, because most of that will be sitting within the National Air Traffic Control System. But that might give us more detail about the impact and the data of noise, flights, etc.
You're absolutely right, Peter. There's a vast amount of work that was done in 2018 for the DCO being developed at that time. And one of the things Heathrow tell us at the moment, that they've got a shovel-ready scheme all set to go. We are questioning whether it is shovel-ready, because we've gone through a global pandemic. A lot of the legislation around noise, air quality, particularly around environmental protection, has now changed. It's been strengthened. So we are pushing Heathrow to review all their documents from 2018, from 2007, and to make sure it is as robust today that it should be for the future. Because whatever the government agrees on in the next couple of years, the airport won't be fully operational until 2050. Heathrow are saying that the construction will be done by 2035, but by the time you get to the maximum air traffic movements, we're looking at 2050, and that's a whole generation. So you make very valid points, and we are pushing for that at these very subject working groups.
Thank you. Katie, I hope you don't mind me picking on you. It's your first meeting. I wondered, given what Sterling has just said about the us feeding into the health impact assessment to make sure that it's really robust and to make sure that we get our NHS partners on board as well, how could you support us with that? Because obviously the health, that's why we're here, isn't it? To focus on the health bit. We know all about the other stuff, but it's really to get the right, the good information provided so that so that it's all sort of comprehensive, really, because I think, as Peter has said, I think we've all seen lots of different information, but we want a good health impact analysis, don't we? Yeah.
I mean, I've been taking sort of copious notes, and I'm going to be sort of taking things back to sort of colleagues at the ICB. I think it's really important for us to acknowledge that the ICB is now a strategic commissioner. Its role has changed quite significantly to sort of like focusing more on population health, with a sort of a real sort of recognition that our providers delivering direct patient care are sort of like the most important sort of individuals in the sort of local borough sort of system at place. And so I think, I mean, Martin sort of mentioned that there aren't any other sort of health partners here today, and I'm not entirely sure who would normally be sitting around the table with us. We mentioned sort of West Middlesex sort of Hospital. It would be good to understand where they are in this conversation, because I think actually they need to be part of this conversation, particularly when it comes to health impact assessments and understanding how it's going to impact on the local population and what that means to them, both as an acute provider, but also our primary care set of providers and also our community services, because they are the people who are going to be sort of needing to respond to that sort of increased demand. So as I said, this is my first meeting. I don't know who normally sort of sits around the table, but I think it's important to ensure that our health partners are here going forwards, and that it's not just the ICB.
You, Katie, really appreciate it, and it's a bit unfair for me to pick on you, but you're the only health person. Okay, I think Martin's going to.
No, and thank you, Katie. And although the ICB is now strategic, I still think in that whole strategic role there is a really key function. So I would think Hounslow would still like the strategic ICB to have a very strong view on this. From our other health partners, unfortunately, due to annual leave and pressure on the hospital and the system due to the hot weather, none of them could attend today. We do have a borough-based partnership meeting on Monday where this is on the agenda as well. So we will ensure, Chair, that we speak to both the acute hospital and a community provider and make sure that their voice is led and heard on this piece of work. So I've already spoken to Chris Hilton from West London Trust, and he fully understands the need for them to be involved.
Can we then make that as a formal action? Because I think that's quite important from the board. Is that okay? Yeah, is everybody happy with that? Because obviously we don't want to lose sight of this, do we? So that's quite important, and obviously we will come back to this. It's obviously ongoing, isn't it? But I think it's good to get this looking good from the beginning. The right partners on board. Okay.
Sorry, Chair, just to make sure that's a clear action. So we would really like a nominated lead from them to ensure we know who is leading on the work on Heathrow.
I think
from
so.
Both organisations.
Yeah.
And I think it would just, because there's 3 boroughs represented by the Hounslow, Ealing and Hillingdon, just to understand, I think it's a question that everybody is asking, is the role of ICBs going forward in this across, because there's about 5 ICBs engaged in the process. So I think that's a question, as the role of the ICB changes, what does that look like at a regional level?
So can I just ask a question? So when you say 5 ICBs involved,
because the study area, I'll get technical very quickly and I'll step out of it, which is the area that is defined to have an impact by the airport, spreads very far west and south. It expands beyond the current RICB into southwest, into, I don't know all the new names, but the 3 other new ones.
Thank you. Any other questions, or we got a bit of a plan, haven't we? Okay. Can I thank you? Actually, thank this really good presentation, and Sterling, both of you. And I'm sure we'll come back to it again. Thank you very much. Okay, so I'm going to move on now to agenda item 5, which is a joint strategic needs assessment update. And we've got Kasturi here. Just, have you got a presentation for us?
Just a verbal update.
Right, okay, that's great. But could we have, for the future, could we have presentations? I just think it makes it a bit it makes it really difficult for me to understand.
No,
I love
agree.
I like to see things,
Yeah.
and it makes it difficult to have that discussion when you're not there. That's okay
Of
for the
course.
future, yeah?
Yeah, no, that's no problem. I think
Thank you.
also with data and insight, it's always better to have visualizations to understand the story better too. So I'll make sure to take that on board. I wasn't here in the last board meeting, but I think Paul Probert had covered the JSNA update, and he had a few reports that were in the process of being published. So I can now tell you that they are published. One being the Social Isolation and Loneliness Insight Report. It has been the original analysis was shared at early officer level engagement, as members are beginning to develop the loneliness strategy, which is a nice example of us taking a data informed approach. And since then, the insight report for the Social Isolation and Loneliness Insight Report has been updated, which now includes updated prevalence, risk factors, risk profile for the topic. So I have a few findings that I thought I'd share. So looking at some of the latest data, Hounslow residents are more likely to feel lonely compared to London and England. And nationally, we've been seeing that loneliness is not just a issue for older residents, but also young adults. So that's also a group that should be kind of looked at a bit more detail. Obviously, with that, there's a breakdown of ethnicity differences, living arrangement differences, also whether residents are divorced or separated or widowed, putting them at a higher risk. And another, I guess, subsection within the report is also looking at carers, and specifically carers in Hounslow, saying that they don't have as much contact as they would like, social contact, as they would like compared with the London and England averages. And this is driven more so by the 18 to 64 age group than the 65 plus. So again, looking at the younger carers. We also have updated the Sexual Health Insight Report from its previous iteration, so focusing on sexual health of both adults and young people in the borough. So looking at prevalence of STIs, chlamydia, HIV and other infections. Also some data on reproductive health and sexual health services in Hounslow. Main finding and highlights from that report are STI diagnosis rate remains significantly lower than London, but slightly higher than England levels. And high prevalence with regards to HIV compared with other London boroughs, and specifically a high late diagnosis rate from 15 plus compared to both London and England. Outside of those two, there has been lots of work going on with the new equality opportunity areas since that has been refreshed and updated. So we've had a whole bunch of insight tools and data reports that have been updated on that, working very closely with Celia's team. So one of them being looking at census profiles for each of the 7 equality opportunity areas. So this dashboard looks at a map to show where each of the equality opportunity areas are within the borough, and then also a census profile for each of those areas, looking at 30 or so data indicators to understand a little bit about the population size, the number of households, the age profiles, country of birth, length of residence, all of it. This can also be taken a look at postcode level in the dashboard as well, so the differences can be seen. Similarly, the census profiles have also been created for each of the LSOAs that fall under the 7 equality opportunity areas. So we now have 34 LSOAs that fall under that. So again, taking a look at a slightly deeper level to understand census characteristics around each of those LSOAs. The main, I guess, new report on the equality opportunity area front is the pen portraits and needs profiles, and this is using more recent data, so outside of census data. So we've used indices of deprivation data to show which domains each of the equality opportunity areas are more deprived in. So that's looking at whether it be income, employment, education, health, etc. Again, that also includes an LSOA breakdown as well. We've also compared different measures using more recent data between each of the 7 equality opportunity areas and total Hounslow. So that could be, for example, comparing what youth unemployment looks like in that area and compare that with Hounslow to understand where we kind of benchmark against the whole borough. We have also done some CACI analysis. So we purchased CACI analysis. It's a licensed data set, and it essentially segments data at a household level to understand more cohesively what group they kind of fall into. So as examples, we've got some groups that are struggling pensioners that can be low incomes in social housing, or young families struggling on low incomes in rented terraces, or another group, for example, single people across all ages living in high-rise estates. So altogether, there are 15 subcategories, and putting each of those equality opportunity areas within the groups to understand more so about their lifestyle, also financial situation as well. The CACI same data set also takes a look at the equality opportunity areas at a health and wellbeing perspective too. So it's linked to their behaviors, lifestyle, financial situation. So looking at incidences of smoking and vaping, unemployment, dissatisfaction with life and jobs, etc. And again, all of that comparing the equality opportunity areas with total Hounslow. And as well as that, we've also, again, on the equality opportunity area front, we've created overview reports. So this is a very summarized report for each of the 7 areas, whether looking into children and young people, crime, deprivation, economy, environment, health, housing, population. So all looking at more recent data for each of those areas. So that's all on the equality opportunity area front, but there's a lot of new updates based on the data sets that we have access to. And as much as it might sound same when I'm speaking about it, there are different angles that each of the different data sets take a look at. So I think it's important to also note that down. There is an update also on the fuel poverty snapshot, where we have higher rates of looking at high rates of low income and low energy efficiency across the borough, which we do see a higher percentage of households that fall into fuel poverty versus London and England. And this is mainly around Hounslow West and Hounslow Central. The Hounslow market position statement has been updated, done by Andrew and team, and it has now been put together on Story Maps, which is an Esri product that we use, and published on the Data Hub. Similarly with a childhood vaccine snapshot report. And those are most of the reports that have been published over the last quarter. One thing Paul had mentioned was the questions on, I guess, usage and views of the Data Hub, which I thought I'd give a bit of an update this time around to you. So over the last quarter, most of the views on the Data Hub came from the Data Explorer page. And what that is you can search for data indicators, you can download, analyze from the page itself. So it's good to see that we're seeing usage from this particular page on the Data Hub. In terms of engagement, so that's in terms of scrolling, clicking, all of that engagement came from the homepage itself, which is nice because we made sure we designed it in a way where ward reports can be clicked on straight away, maps can be clicked on straight away. We have some key stats on the homepage itself. So again, nice to see that that's being used. We had almost 450 users in total, and half of those were new users, so 208 new users in April to July. In terms of where those new users came from, they were mainly through organic searches, which means people are searching them into Google and taking a look at it themselves, and then the rest was by following a link, whether that's been shared on another website or been sent to them. Yeah, I think those are the main updates. In terms of next steps or work in progress, I have been reflecting on the data hub structure in terms of how the reports are structured on the website to be aligned with the new corporate plan. So those updates should be published next week, I hope. It's a bit of a manual process on the back end, so that just needs to be sorted out. And State of the Borough 2026 is being worked on at the moment, so that should be ready to be used as an evidence base the next time we have a Health and Wellbeing Board meeting. That's all from me.
Thank you. A lot of information, but this is all on the hub,
Sorry.
isn't it?
Yes.
Yeah. Just a couple of, just to remind everybody, this is on the hub. So they can find the information that they want. You mentioned at the beginning of your presentation about social isolation. And as you know, obviously, one of our priorities is to have a loneliness strategy.
Yeah.
And you mentioned an insight report. I'd be quite interested to read this.
Yes, I can share that with you.
Yeah.
It is on the Data Hub, and it is on the homepage since it was very recently published.
Okay.
But I can definitely share that with you.
Okay, thank you. Peter?
Chair, I welcome your comment at the beginning of this session that it would be very helpful if there was a formal presentation. I've tried to listen very carefully, but could not absorb any of the information that you've given. So I actually don't know what new key reports have gone on the hub. I don't know what new key updates are now there. Having a summary of those key updates or key new reports, I think will be very useful for officers in my organisation and other community organisations to say, there is a new report on social isolation. Let me go and have a look. At the moment, I don't have anything. I can go to the hub, but the hub has a huge amount of data. And I will go to the hub if I'm looking for something. What I'm trying to do is understand and discharge my responsibility of the new Joint Strategic Needs Assessment. What has changed in the assessment? And does that mean we have to debate any particular change in what we're doing or the services we provide because something's changed in the assessment? And at the moment, I haven't quite got that. But having an update that says, these are the new reports, these are the new links, this is something that would be useful to focus on, then that would be helpful for me and my staff.
Yeah, definitely.
Thank you.
Yeah, I to be honest, I don't. I think this was just put together quite quickly that I hadn't got there. But I can definitely put together a presentation that will be a bit easier to follow next time.
Yeah, we can take it offline. But it would be good. I think it's just so we have a bit of a summary which sort of triggers a discussion, like a story behind some of the data. So, but thank you. Thank you very much. Appreciate it. Exactly. Thank you. In that case, I will move on to agenda item 6, which is the Healthwatch quarterly 4 update. And I'm going to invite Peter Goulding to give a presentation. This is the standing item on the agenda. So, Peter, over to you.
Chair, thank you very much indeed. In the papers is the latest patient engagement report. I have the slides. I can go through them. I will propose not to do that. Substantially, the information that you have there is no different than the information we've previously given on other quarter surveys. The messaging the improvements, the good credit that people have highlighted in their patient experience, as well as some of their concerns, are substantially the same. And just to remind everybody, we do that at GP level, we do that in the acute, we do that with dentists, we do that with pharmacies, we do that with community services. So if you would like me to go through, I can go through it, but I would perhaps like to raise 2 or 3 other points which might be more useful to discuss. We've just issued our annual report. It is on our website. It's circulated to the Commissioner and all other parties. That gives you a snapshot of what Healthwatch Hounslow have done for you in the last year. One of the key points, just to raise a couple of ones, we did a joint inspection review in West Middlesex Hospital that went round and looked at various wards. We did this jointly with Richmond Healthwatch. That report has been published. There was lots of positive things. There were some areas of concern which was raised to West Middlesex, and I know they picked it up, and I know they've done that. We will be issuing a report very shortly, probably the end of this month or the beginning of August, on extra care housing. That was a piece of work that we were commissioned to do, and we've done all the analysis. We are just completing that and doing the report stage, and then we will submit that through the commissioners in terms of the normal process, and then that will be published. That will be quite interesting because I think that's the first time we've done an extra care housing assessment where we've gone around and looked at and spoken to a number of residents. Been quite difficult, understandably, but there's some interesting insights that will come out in that report. We've done previously the 0 to 4 attendance at A&E linked to what we were trying to do with more GP appointments. That was published some months ago, and we're now looking at whether we should be doing some work around young adults going into A&E. Why are they going into A&E rather than into GP? So there's work in progress. And just to remind you, on my more substantial discussion I want to raise, the health bill is in front of the committee stage in Parliament. That health bill, if it is enacted, will abolish Healthwatch. And if it gets enacted, it's likely to be in April 27. Therefore, Healthwatch will be abolished statutorily. We will be removed from this particular board. And what will happen in this board, I'm not quite sure, because that's part of the potential changes in the health bill. So I just wanted to raise really that I would encourage and ask that this board set aside an agenda item, a substantial agenda item at some time to debate what Hounslow would like to do if that bill is enacted, because we would no longer exist to provide you an independent survey view of patients and the public and residents on health and social care services. The bill substantially changes the way in which this landscape operates. Healthwatch would disappear unless you put something else in, but the responsibility is split. ICB will have responsibility of looking at patient experiences around health. The local authority has a separate statutory authority to look at social care. ICB will have a statutory responsibility to report to the Department of Health and Social Care. It will be a statutory responsibility, says the bill. The bill says a local authority may be required to provide evidence of what it is doing to find patient and residents' experience on social care. The details of this are not in the bill. The clause just removes this, gives the statutory responsibility to the 2 different partners and splits that. And how that is actually going to operate, the guidance is not written. I know the guidance will not be provided by the Department of Health and Social Care until it is enacted. That's post April 27. You have funding for Healthwatch until the end of this financial year. The Department of Health and Social Care is indicating that if there is a delay, a further grant will be given. but of course that depends upon potential changes. And I would invite this board to set aside some time, maybe after the ICB have given an update of what they plan to do, about how you would like this whole system to work if this bill actually comes into fruition. One of the key points that have been discussed by health and wellbeing boards across the country and by other ICBs and local authorities is, how do you want to manage the independent collection of these services? Because in effect, a concern has been raised quite widespread, is that you could be marking your own homework. Local authorities will effectively go out to ask people, and they will be marking their own homework. Healthwatch provides an independent way in which to do that. That might be something that you want to consider in the future, and how that might operate, and how you might operate in terms of a resident's experience of health and a resident's experience of social care that is statutorily being a responsibility of two separate bodies. And with respect to the ICB, they've got 13 boroughs, 4.5 million population. That's going to be quite a large ask for them to be able to give us the detail of what the impact is on our own residents. So, Chair, my plea is that we have a formal agenda item sooner rather than later to discuss this, so we can start planning and thinking around what systems and structure you would want within the borough-based partnership and within Hounslow to operate in the future.
Thank you, Peter. We had a discussion before the meeting, and I really appreciate your comments. I'm going to take the two things separately. Firstly, thank you for your report, actually, and it was interesting to read it. Does anybody have any comments or questions about the last Healthwatch report? No?
Chair, just to say thanks again, and it is an interesting read. And Peter, your language about it sort of being the same, and do you feel from it, when I read it and we discussed it, there doesn't seem anything alarming that you're raising, but is there anything in it that you would really like to bring to our attention at all? Or
I think there's lots of positives. I think that is really good to acknowledge, and the positives tend to be very consistent over each quarter of our survey, and has been for a long time. When people get to talk to clinicians, or they get to talk to people delivering social care services, it's generally a really good experience. It's getting in front of those people, it's the communications, it's the appointments, it's the delays, it's a lot of the administration, as we understand, causes real concerns. But I think that, and there's some positive things that we're seeing in some of the community services, but again, it comes down to the detail that very often the frustration is when the thing is not integrated. And of course, that's what we're all trying to do, is we're trying to have an integrated service, but the patient, the carer, is not experiencing that integrated service. And they feel it's very fragmented. And it comes out as the sort of underlying thread in some of them. The other thing that we're also picking up is that GPs do a lot of their own surveys, but indeed they've been approaching us locally here in Hounslow to say, look, you're getting more better evidence than we get. You're getting more knowledge around my patient experience. What can we learn from you? So they do have a mechanism, but I think there's still a gap. And what we're trying to do is identify what is it, those little improvements that we can make in the system.
thank you.
Thank you. And your second point around the future of Healthwatch. Obviously, we don't know what's going to happen, So I think it's best. I've obviously got a new Director of Public Health as well. So what we're going to be looking at are future agenda items on the board. So we'll certainly take that into account as to, you know, how we go forward. Do you want? Yeah, Martin.
So Peter, it's an interesting time for us all. So we've had the local elections. So we've got the next 4-year term of the Labour Council. The corporate plan has just been published this week, which is a key document. And now Chair has also said we've got a new Director of Public Health. We've also got the new strategic ICB, so we've got to understand what the strategic ICB. We also have the new local integrator, which is West London Trust. And now we've got your Healthwatch challenge as well. So there is a changing landscape, which is starting to get more clarity. And so we are talking, so the current health and wellbeing strategy comes to an end in this year. We are looking at the future direction of the borough-based partnership in light of the role of the ICB. So I think this is a perfect opportunity for us to look at the future health and wellbeing strategy, the future role of the board, the future role of how we monitor neighbourhood health and the delivery of health corporate plan. And then the key thing is the resident voice. And if you read the corporate plan and most health documents, the resident patient voice is still a critical thing. So it doesn't go away. You're closer to the bill than we are. I'm surprised it says nothing about the future, but what Hounslow will always want is the resident patient voice within the work we do. So I'm sure there'll be other discussions other than the Health and Wellbeing Board. You will be involved in it, but I just think it is critical that you hear that that is really important to us as a health system and to the council. How we engage with you next, I'm not quite sure whether it's a key part of this meeting. We're talking about how we work as a complete board, but it's definitely a conversation we'll be having.
Well, and thank you ever so much for that comment. And for the record, I think that's very, very important, very useful. Just to try and help is that I have, along with chairs of other health watches across England, we have a regular meeting with the Department of Health and Social Care to talk about Healthwatch, but we're getting some information about their thinking through that, which I can feed in. But we're also got a mechanism where everybody else is in the same boat. They've all had elections. They've all had some changes in ICBs. They're all, got this uncertainty, but other areas are developing various plans. We can provide some information, hopefully, to sort of say, well, Manchester is thinking of this, Norfolk are thinking of that. That might be helpful. It might not, but we can perhaps provide that information to help that debate if it is felt necessary.
Yeah, I'm sure that would be helpful. And I actually do want to stress the point that our corporate plan, Martin is absolutely right. The corporate plan has a big focus on the residents' voice, and that's the golden thread going right through it. So whatever happens in the future in terms to Healthwatch, we will be listening to our residents and making sure that they are part of what we kind of, how our services are shaped. So that definitely, I can assure you, will happen. Okay, I think we'll move on to the next agenda item. Thank you for that. And that is going to be you, Martin. And this is just this is a standing item that we have where we sort of sign off the Better Care Fund. But I thought it would be quite useful if Martin just gave us a sort of very brief summary on what are the projects that come under the Better Care Fund and progress and how we're doing, so that you'll get an idea about what we kind of sign off here. Thanks
very much, Chair. Yep. So everybody, I talk about the Better Care Fund every quarter because it's our responsibility to sign off the report. So this is in your pack is the quarter four report back on our performance. Just to remind you, it's a fund of approximately £44 million joint fund between the council and the NHS. Its key purpose is to reduce emergency admissions, to improve discharge, and to reduce residential care admissions. And all those areas we have improved. And Councillor Bath, I think the Better Care Fund has been around for as long as you've been chairing this meeting. And so we've continued to see improvement. I think one of the things about Hounslow and the Better Care Fund is our collaborative leadership, our shared governance, and our integrated workforce. So one of the schemes I'll start talking about, but I'm sure Stephen Forbes will also talk about it as he's much closer, but is our hospital to home work. Stephen's been really one of the key leaders in ensuring that happens, working with colleagues within the NHS. It's approximately £900,000, and it was using our collaborative leadership and integrated workforce to support discharge from hospital. It was in response to issues around supporting very complex patients, especially those with dementia and delirium, and with complex behaviours, to get them out of hospital and back into their homes as quickly as possible. There was very much joint design, joint oversight, community service were involved working with West Mid consultants. And this model has resulted in us reducing 490 acute bed days. So clearly, people need to be in hospital for as long as possible to get the right care. But as we all know, there is a time where people want to be back home cared for in their beds. So the residents of Hounslow have benefited by 49 days of that. And as I say, this was integrated work in between the hospital team, the community health team, social work team, but also, and often we don't mention them, our home care providers that are a real key part of the system, but also quite a lot of area where the Better Care Fund is spent as well. So this really joined up approach to support patients, residents of Hounslow to return home and live independent lives. Again, so it's discharge, tick, but also not going into a care home. We're very focused to getting people back into their own homes in Hounslow to live independently. So other than that, I thought it'd be a little good news flavour of what the work does. I can do more at the next meeting if helpful, but otherwise, just to confirm, the board is happy to sign off the return.
Thank you. Thank you for that, Martin. That just gives us a bit of an idea about some of the projects and the progress and what the money is spent on. Does anybody have any questions at all or comments? No? No? Okay. So in that case, the board is happy to sign off. And as Martin said, if there's anything in there that you want any future sort of updates on, then anything in particular project, then do let us know. Okay, thank you. So we'll sign that off, Martin.
Thank you.
Okay, and then we move on to, I think that's it, right? It's any other business. And I haven't had any other business brought to my attention. No? Okay, in that case, I formally close the meeting, and I'd like to thank everybody who joined in person, but also those online as well. And do we have a date for our next? No, 14th of October is our next meeting. So have a lovely evening all, and thank you very much for all your contributions.